हेलो फ्रेंड्स, वेलकम बैक टू माय यूट्यूब चैनल AR रिजोल्यूशन। ये पार्ट 3 वीडियो है हमारी मेडिकल ट्रांसक्रिप्शनिस्ट का जो वर्क होता है उसमें जैसे MRI की रिपोर्ट्स बनाते हैं तो MRI स्पाइन में जो फाइंडिंग्स होती हैं उसको टाइपिंग की जो है हम इस वीडियो में प्रैक्टिस करेंगे। पेशेंट फर्स्ट की वीडियो है, ये हमारी टाइपिंग प्रैक्टिस है। There is a straightening of lumbar spine, full stop, next line. Degenerative changes are seen in the form of osteophytes at multiple lumbar vertebral levels, modic changes and disc degenerative changes, full stop, next line. Sacral listations of L5 vertebral seen, full stop, next line. Right foraminal disc protrusion seen at D10 to D11 level, causing thecal sac indentation and narrowing of right neural foramen, full stop. Indentating right exiting nerve roots, full stop. AP canal diameter at this level measure 10 mm, full stop, next line. Diffuse disc bulge at L1 to L5 level, causing thecal sac indentation and narrowing of bilateral neural foramen without any significant nerve root comparison, full stop. AP canal diameter at this level measure 11.3 mm, full stop, next line. Posterior central disc protrusion with bilateral ligamentum flavum hypertrophy seen at L2 to L3, full stop. L3 to L4 and L4 to L5 level, causing thecal sac indentation and narrowing of bilateral lateral races and neural foramen, full stop. Indentating bilateral descending nerve roots with spinal canal stenosis at L2 to L3 and L4 to L5 level, full stop. AP canal diameter L2 to L3 levels measure 9.8 mm and L3 to L4 level measure 12.5 mm and L4 to L5 level 9.4 mm. Next patient 2. There is a straightening of lumbar spine, full stop, next line. Lumbar station of S1 vertebral seen, full stop, next line. Diffusion disc bulge seen at L4 to L5 level, causing thecal sac indentation, full stop, next line. Diffuse disc bulge seen at L5 to S1 level, causing thecal sac indentation and narrowing of bilateral lateral races of neural foramen, full stop. Indentating bilateral descending nerve roots, full stop. AP canal diameter at this level measure 14 mm, full stop. There is increasing at atlanto-axial distance of approx 8 mm, full stop. Tip of the odontoid in approx 10.4 mm above the chamberlain line, suggestive of atlanto-axial subluxation with basilar invagination, full stop, next line. There is stretching and hyperintensity involving the transverse ligament with posterior subluxation of dens, causing narrowing of foramen magnum and causing of comparison of underlying cervico-medullary junction leading to stenosis, full stop. AP canal diameter is approx 7 mm, full stop, next line. Intrasubstance hyperintensity also seen in posterior part of cervical cord, likely due to comparison myelopathy, full stop, next line. There is partial function of posterior elements of C22 and C3 vertebral body, suggestive of partial block vertebral, full stop, next line. There is partial function of posterior elements of D1 and D2 vertebral with rudimentary intervening disc space suggestive of partial block vertebral. There is straightening of cervical spine, full stop. Next line, posterior disc bulge seen at C6 to C7 level causing thecal sac indentation, full stop. Sacralization of L5 vertebral scenes, full stop. Third patient. There is a straightening of lumbar spine, full stop. Next line, anterior marginal osteophytes are seen at multiple lumbar vertebral levels, full stop. Next line, knot is made of hemiangioma in L3 vertebral body, full stop. Next line, posterior central disc bulge seen at D2 to L1 level causing thecal sac indentation, full stop. Left foraminal disc protrusion seen at L2 to L3 causing thecal sac indentation and narrowing of left lateral races and neural foramen, full stop, comma, indentating left exiting nerve roots, full stop. Apicanal diameter at this level measure 10 mm, full stop. Next line, diffuse disc bulge seen at L3 to L4 level causing thecal sac indentation and narrowing of bilateral lateral races and neural foramen, comma, indentating bilateral descending nerve roots, full stop. Apicanal diameter at this level measure 12.7 mm, full stop. Next line, posterior central protrusion with bilateral ligamentum filum hypertrophy seen at L4 to L5 level causing thecal sac indentation and narrowing of bilateral lateral races and neural foramen, full stop, comma, indentating bilateral descending and exiting nerve roots, full stop. Apicanal diameter at this level measure 10 mm, full stop. Next line, diffuse asymmetrical disc bulge seen at L5 to S1 level causing thecal sac indentation and narrowing of left lateral races and neural foramen, comma, indentating left descending nerve root, full stop. Apicanal diameter at this level measure 11.8 mm. Patient number 4 patients की findings. There is straightening of cervical and dorsal spine, full stop. Next line, degenerative changes are seen in the form of osteophytes at multiple cervical and dorsal vertebral levels, modic changes and disc degenerative changes, full stop. Next line, post-operative changes seen in cervical spine in the form of non-visualization of posterior elements of C2, C3, C4 vertebral's body, full stop. Next line, there is diffused thickening of posterior longitudinal ligament from C2 to C7 vertebral body, which along with posterior bulging disc is causing effacement of anterior epidural space and causing comparison on underlying thecal sac, leading to comparison of C5 to C6 and C6 to C7 level, full stop. Apicanal diameter at C5 to C6 level measures 9.3 mm and C6 to C7 level measure 7.8 mm, full stop. Next line, any intramedullary T2 weighted oblique steer hyperintensity seen involving cervical cord behind C3 and C4 level measure 13 mm in length, suggestive of myelomalacia due to sequelae of compressive myelopathy, full stop. Next line, grade 1 retrolisthesis of C3 over C4 level, full stop. Posterior disc herniation seen at D3 D4 full stop, D4 to D5 and D5 to D6 level causing thecal sac indentation, full stop. Next line, Vidic collapse of D8 and D9 vertebral bodies with reduced intervening disk space and altered signal intensity appearing, hyperintensity on T1 weighted images and hyperintense on T2 weighted and steer images suggestive of bone marrow edema with pre and paravertebral T2 hyperintensity collection at D8 and D9 level. Maximum thickness measure approximately 11 mm. Full stop. Next line. Thin collection also seen in anterior epidural space at D8 to D9 level causing its effacement and indentation of underlying thecal sac and spinal cord causing spinal canal stenosis. Full stop. There is narrow of bilateral neural foramen indentating bilateral descending and exiting nerve root. Full stop. Next line. There is a staging of dorsal spine. Full stop. Next line. Degenerative changes are seen in the form of osteophytes and multiple dorsal vertebral levels. Disc degenerative changes. Full stop. Steer hyperintense focal lesions seen in D1, D2, D3 and D10 vertebral bodies with preserved adjacent is likely possibly of meteoritic etiology bracket open metastasis oblique multiple myeloma bracket close need to be considered. Patient fifth, alternative signal intensity appearing hyper intense on T1 weighted images and hyper intense on T2 steer images seen involving D4 and D5 vertebral bodies with reducing intervertebral disc and D2 hyper intense collection in anterior pre and paravertebral space exiting from inferior end plate of D3 vertebral bodies up D5 vertebral bodies. Next line. Full stop. Next line. Maximum thickness measured 12.3 mm at D4 levels. Full stop. Next line. The collection is extracting into anterior epidural space at left lateral aspect of D4 vertebral bodies causing comparison of underlying thecal sac and left neural foramen comparison left exiting nerve root. There is straightening of cervical spine. Full stop. Next line. Anterior marginal osteophytes are seen at multiple cervical vertebral levels. Full stop. Next line. Posterior central osteophytics disc bulge seen at C3 to C4, C4 to C5, C5 to C6 and C6 to C7. Level causing thecal sac indentation and posterior annual tear at C5 to C6 level. Full stop. AP canal diameter at C5 to C6 12 mm. There are degenerative spondylotic changes in the cervical spine with marginal and plate. Full stop. Next line. Osteophytic and desiccative intervertebral disc displaying hyperintense signal on T2 weighted images. Full stop. Next line. Grade 1 anterolisthesis of C5 over C6 vertebra noted without spondylosis. Full stop. Next line. Diffuse disc bulge is noted at C3 to C4 level along with ligamentum phalanx hypertrophy indentating the anterior thecal sac without our nerve root impairment. Full stop. Next line. Diffuse disc bulge is noted at C4 to C5 level indentating the anterior thecal sac without our nerve root impairment. Full stop. Next line. There is broad base central left foraminal disc protrusion osteophytes complex noted at C5 to C6 thecal level causing marked narrowing of left neural foramen and impingement of left exiting C6 nerve root. Full stop. Next line. Diffuse disc bulge, uncurvatable osteophytic complex noted at C6 to C7 level causing thick moderate moderated narrowing of neural foramen and impingement of bilateral exiting C7 nerve roots.